Jen Wagner, welcome to the Lean Out podcast. How are you doing today?
I'm great. Thank you for having me.
You're welcome. I'm excited to talk to you. Tell us about your work-life balance and how it is different from other people in your profession.
Okay. So I'm an OB anesthesiologist. I made a big change in my career path about a year ago. I'm working per diem for a hospital system, the same one that I was previously working full time for. And I have, over the course of the past year, started doing some more creative projects. I started a podcast called The C-Section Experience, which I'm doing with a friend of mine, where we educate on all things related to sort of C-section birth education. And I have some other kind of content creation projects up my sleeve too that I'm starting to work on as well. It's all kind of focused on patient education, basically, in my field. So,
Yeah, now tell me a little bit about how much you are working clinically now versus what you were doing before.
so I have changed. It's kind of funny. I have changed my work schedule so many times since I finished residency in 2017. And I worked at an academic hospital for about 2 years until the pandemic happened, which is at the same time I was pregnant with my second child. And we were already looking to move to kind of a bigger apartment from New York City. And we just couldn't find anything that was what I had envisioned for a bigger place. So we ended up looking farther out and finding a place in Connecticut. So I moved, just all the things kind of happened at once. And I decided I'm just going to look for a new job out in Connecticut, which I did. And at that point, so I started at a community, like kind of a smaller community hospital, which was a very different work environment for me, kind of a shock to the system a little bit. And I decided that the best thing for me would be to work kind of Monday through Friday. I thought that was very exciting, not to work weekends. And I quickly realized that that for me was also difficult. I kind of missed having the post-call days and having some days during the week, with my two small kids that I could spend time with them. So let's see, what did I do first? So then went to a full-time call taking position. And at that hospital, there would be 24-hour calls with two post-call days. And that worked out for a while. But I felt just still, as my kids got older and their needs changed, I still felt like I wanted to find a different way to be more present and be more available for them. So then I kind of negotiated this other schedule, which was longer days and fewer calls, but so it wasn't just the typical normal full-time call taking, but I would still take calls, but just work fewer days, but longer days, essentially. So that's what I was doing before I decided to just completely go per diem a year ago.
And what was it that prompted you to switch to per diem? Was there a particular turning point at your job, or was it just related to wanting more time with your family or anything like that?
Well, no, there was a big turning point. I don't know if I've even, because so I reached out to you when I was going through a lot of this and did some coaching with you as I was trying to figure out what exactly I wanted. But this is kind of like a sad part of my story. I don't think I fully explained it to you before, but I think it's worth mentioning. I was pregnant with a third child. And when I was about 11 weeks along, I had gotten my NIPT test done. And I was working on labor and delivery. And the MFM who had done the test for me came into the room. Like I had just placed an epidural for a patient. And he pulled me kind of out of the room and said, I need to talk to you. And I was given the news, so at work, at labor and delivery,
Gosh.
that, yeah, that my baby had trisomy 18. And so I, that was obviously like a huge shock for me. And I had to leave work, process this information. And long story short, I went and the next day I was able to get a detailed ultrasound with kind of a specialist. And there were a lot of things wrong, everything that goes along with kind of the most severe form of trisomy 18, a large omphalocele, high drops, a lot of signs of, impending loss, and definitely that there was going to be no live baby for me. So that was very traumatic. I didn't even realize at the time. I was in kind of a shock state, I guess, and made decisions that were, very clear for me, but I went in and had surgery the next day. Um, and that was like a Friday, I think. And I thought I might go back to work on Monday. Um, because yeah. And
That's what
I
we do, right?
right, yeah. I was like, okay, I'll recover over the weekend. And on Sunday night, I emailed, my boss, and I said, I've just lost a pregnancy and I can't come into work. It just so happened that the following week I had a planned vacation. Like we had to pick our vacation weeks over a year in advance. And it just so happened that the next one would have been a vacation week. So when I was going to go back into work, I sort of told myself, well, just get through this one week and then you'll have a week off and then you'll be good. But I couldn't do it because having never experienced this type of grief before, you don't know how you're going to react. And my body, after I got through those first initial days of shock, I couldn't get out of bed for that whole week. I just couldn't move. So I realized that going to work was not going to happen. And it was really hard for me even to write that email and to say, there's so much guilt, right? I felt so bad at calling out of work is not something I ever take lightly, and you're just thinking, oh, how is this going to impact the schedule? And who's going to have to make up for me not being there? And who's going to be mad? Um, but I had no choice. So I wrote a really quick email and took that week off. And then I had the second week off. And when I did go back to work, it was funny because my favorite thing, my passion in life, obviously, it's obstetric anesthesia. I love taking care of pregnant patients. That's where I'm the happiest. And I was kind of wondering, but that's not all I do, right? So you never know. I get the schedule the night before and see where I'm going to be working the next day. And I was wondering if they would put me on labor and delivery because I just sort of told them pregnancy loss, but they did. I was like, okay. and
Thanks, guys.
and that's like you can't make this up. I walk in the morning and a young girl has an eclamptic seizure and needs a stat C-section under general anesthesia.
Oh my
Like,
God.
and I was it's just you can't. And I called it, and luckily, I called one of my colleagues, like she came to help. I was sort of just going through the motions of taking care of this person. And that's the moment I was like, oh, this is affecting me more than I realized, especially just being back in that exact place where I had gotten the news and sort of flashing back to all of that. And because I had a C-section before, but I'd never been put asleep before, which I had been for my D&C. And so I started to kind of see myself every time I put a patient to sleep, which was rough and different for me. So then I said, okay, maybe if I'm not on labor and delivery, maybe I'll be okay. And those days were worse actually because I was not doing what I loved. And it almost gave me more time to just think through all of the things that I was sad about. And anyway, the next few months, I don't know if it's just like you're just noticing it, but it felt like I was seeing so many complications on labor and delivery, just so many, things that happen all the time, but I was processing them in a different way. And I I just I just needed to do something. I needed that space. I knew I needed time to really work through my emotions, and I started thinking about things like provider trauma and how all the things that we see probably affects us, and we don't really take time to appreciate that. So I was thinking about the thing that I went through, but then also, I think when you go through something traumatic, it brings up any prior trauma that you have. So I I knew I needed a break, and I knew I still loved my job. And uh, I also started thinking about h- empathy for my patients and how I've always been very, very empathetic. But at that moment in time, that was hurting me. It was too much. And I said to myself, I could get past this and kind of become more cold and not look at every patient in such a deep way and feel so bad for them. But I didn't want to lose that. That was how I defined myself. Like that's what I thought made me better in some ways than other people, was my ability to connect with people and care about them and talk them through difficult situations. And I felt like at that moment, if I didn't cut down on my clinical work, I would lose that. That was the only way to survive, was losing some of that empathy. And I felt that coming. And so making the decision was, first of all, I didn't know if I could, right? I didn't know if this was possible to have more time for myself. Plus, with the grief and everything, I'm like, okay, self-care, I've neglected that my whole life. I never have time to exercise. Everything is all about my kids or my job. My kids are my job. And so I knew I needed to find more time to take care of myself mentally, physically, all the things that I really wanted to do forever. It felt like, I guess this was a good enough excuse almost. I know. But I felt like I needed this excuse. And it was like, if there's one thing, this was the catalyst, but it was really years and years of various things bubbling up all at once in order to give me the confidence to, I guess, finally take action.
Jen, I just have to say, you're right. You did not share this with me when you came to me
Yeah.
for coaching. You were a bit past that timeline. And
I
I
wasn't
just have
ready
to
yet.
say
Yeah.
I'm so sorry about
Thank
that.
you. Thank you.
It is, I mean, as someone who has also had a loss, and everyone's loss is different and their grief journey is different, it is so hard. And
Yeah.
it's a death in the family that not everybody recognizes for the gravity of what it is.
Yeah, you don't realize until you go through it for sure.
Yeah.
Because even though I say I thought I'm pretty empathetic, after it happened to me, I was like, oh, I never, other people who went through things, thinking through, oh, I wasn't there for them enough, or, you just don't realize. But
Yeah.
yeah,
I am so glad that this was your catalyst, because what I remember from you coming to me was, I am deciding that I'm going to go per diem or I'm going to go part-time. You had the negotiation in the works, but
right.
it was more like, I want to express my creative self. I want to find fulfillment in other places, and I want to be present for my family and myself. But having all this background, it just makes even more
Yeah.
sense. And you're right that it seems like we shouldn't need a reason to do
Right. You
these
shouldn't.
things.
Yeah.
But I'm so glad that, that you really did wake up to the fact that you need to make these changes.
I read a book and now I'm blanking on the name of it, but it's, when you go through something like this, you're just looking for support groups or just anything I could find. And there was a book written by a woman in the UK who had had to terminate a wanted pregnancy. And so the book wasn't about that, but she talked about it and how she was a photographer and how she leaned into photography as a way to cope with her grief. And she talks through creativity as a means to healing when you're going through grief. And that book really, I mean, I sat there and tried to draw. I was like, what am I creating? What am I good at? I'm not a creative person. And I went on YouTube and was like, teach me how to draw. But in a way, it was very meditative and it stuck with me that I do think using these different parts of our brain than we are used to in medicine is really therapeutic, or at least it was for me. And so that was I think what I was telling you about how I wanted to find that way to be creative and really just, yeah, like think differently. And that's been really, really helpful to me.
Yeah, and your passion for obstetric anesthesia really comes through, and now you're doing this educational work. So tell me how you decided what to focus on, like to, do a podcast versus something else.
Yeah. So I actually think I found you through a podcast too, but during this whole period of my life, I discovered podcasts and I was looking up physician women podcasts, and it's just been thinking through different schedule options and how to talk to your employers and how to be more confident and this and that. So I just had really, from a self-help kind of aspect, I had grown to really love podcasting. And I, how it happened that I started this podcast about C-sections is I couldn't do it on my own. I was too scared to just start something on my own. And so, very luckily, one of my very best friends who lives in my neighborhood, we met in 2020 when I moved out here to Connecticut, and our kids are best friends. We're very close. And is she's a nurse, but she doesn't hasn't she's mostly been a stay-at-home mom for the past 8 years. And also she had a very bad stillbirth with her first child. And so she was really one of the few people when I was going through this who kind of knew what to say and was like on point with every comment every time she reached out. So we got even closer after that. But she used to work doing different birth education things. She had a class. She was a doula and she's kind of very into just educating, but also a lot of mental health type of stuff for pregnant and postpartum women. And she's was fascinated by my job because I would tell her about, what I know, and she just loved to ask me so many questions and learn about it. And so we had always kind of joked that we would do something together because this was always in me forever that I wanted to do something for patients outside of the hospital because I mean, my favorite thing, I love an anesthesia consult. I know it drives some people crazy. Like, I don't want to talk to a woman who's not having a baby for 8 weeks, you know, about her anesthesia. But for me, I love it. I'm like, I'll give her a call and talk to her about whatever the concerns are, whether it's a more complicated medical issue or not. I love that. So we have both had C-sections, and her story, because of the stillbirth, she like was thought she'd be the unmedicated vaginal birth. type of person. And after her stillbirth, she needed a lot of control. And so she had elective C-sections, which was this crazy mind shift for her. And my story is that my daughter was breech. I had a C-section. I was like, whatever, I didn't care. But then I really wanted to be back afterwards and have kind of gone in the direction of, had I had that third baby, I would have wanted a doula and all this stuff. But it just felt like a natural topic that we could discuss. And we started looking into it, and there wasn't much. I mean, there's so much birth, thebump.com, like every, good for better, for worse, a lot of people talking about things related to birth, but we couldn't find anything. There's not much, really focused on C-section birth. So we we just thought it was an easy way to start because all we had to do was talk. We didn't have to write anything, proofread anything. My friend doesn't even use social media. Like she doesn't even know how to use Instagram. And I do, but it just felt like a lot of work. So it all kind of worked out. And so then I started listening to podcasts about how to start a podcast as one does. And it was a little challenging I because there was two of us, just the extra plug-in of just the technology side of it, I just I couldn't get it together. My brain wasn't quite there. And I was searching for some kind of studio or someone. Maybe I can find someone to help me set this up, tell me what to do. I have no idea. And 2 months before we were having this conversation, this new place had opened up that was kind of a podcast in a box. They said, for X amount of money, and we're splitting it, so it wasn't really that much. We'll just do everything for you. Put your podcast out into the world. You come in, you record. We have the microphones. So it felt like it all came together at the right time. And so we just decided, let's do it. Let's try it. And now we're almost a year later, we're still doing it and things have evolved, but that's kind of how it started.
I love it. And I'm going to make sure to link to your podcast. But the other thing is, I know there's a particular episode that's more recent where you really do talk about this stuff, the C-section shame and the idea
Yes.
of people coming into their birth and thinking that they're going to be unmedicated or like they are just going to have a doula and it's going to be this like natural experience or something. And then like something medical happens and there's a lot of shame involved in that. And so you're demystifying some of the medical sides of the birth experience, which is wonderful. You're right that there's no one out there really like talking about this side of things.
Yeah, I try to I kind of sprinkle in the education amongst the conversation, but as it's evolved, just being in the podcasting space, you get invited on other podcasts, and that's was always the number one question is what do you think about C-section stigma? And we've experienced, people even have inviting us on their podcast and really being so negative. And, it's not helpful. Like we see this show as for someone who has either had a C-section or knows they're going to have a C-section. So talking about all the downsides, I just don't think is helpful to those people. And there's enough positive stuff, how can we make this experience better? What are what are the bright sides, and understanding because it's a crazy thing. Like if you think about it, being completely awake, having your baby, but having a surgery at the same time, there's just so many intersections that happen during a C-section. And it's like the more we talk about it, the more we have to talk about. There's just a lot. And now that we're getting interaction with the listeners and all the just people have a lot of questions. And for the most part, I can answer them, being that I'm the one who's usually sitting with, the person having the C-section. And so I feel like I intimately and I've had one myself, but I feel intimately aware of what comes up for people before, during, after their C-section. So it's been really awesome. And like I said, for me, it's been learning this whole new world, learning how to edit a podcast. I mean, it's been fun though, because I think as physicians, we are learners, right? We love to learn new stuff. And I'm looking stuff up too, right? If I don't know something or I forgot, what exactly is that? I'm reading papers and kind of keeping myself up to date, which I think is good for my patients in the hospital too. So the whole process, I think, is positive for everybody.
Yeah. I have so many things I want to touch on related to your work-life balance and to this topic, but I do want you to highlight for a moment for the audience, because I think a lot of people, unless they're anesthesiologists, don't really know, like what it is about OB anesthesia in general that you love, and what do we do as OB anesthesiologists? Like it's a huge role.
Yeah, yeah. Thank you for asking that. Because the other kind of secondary passion I have is just awareness about OB anesthesia
Yes.
and the importance of the role. I think it's downplayed a lot. But when you, as an OB anesthesiologist, I understand a lot of obstetrics, and it's a pretty new field, like in the scheme of things, right? When we talk about epidurals, and risks of C-section, and we're constantly making things better for patients, improving mobility and changing the doses of medications that we use to make sure that this epidural is more likely to work for labor, likely to work for a C-section if a patient then needs one. And when it comes to C-sections, tailoring medications for reducing side effects. And we're really, I mean, we're good at putting in epidurals, but it's more than that. There's all these little kind of tweaks that we can make to make these experiences better for patients, because whether it's a epidural for labor, pain management for labor, or, C-section, reducing these complications and making sure the anesthesia works in a really positive way. Obviously, we also are the ones that are there managing complications. So we're very, familiar with blood transfusion and all of that stuff, but also when do we need to put a patient to sleep? When do we not? When can we use neuraxial anesthesia versus general anesthesia? We're just, I think, very good at making these choices, and we're just really tailoring it to the patients, I think, is the main thing.
Yeah, I love it. And also, you talked about anesthesia consults, because sometimes people come in and they're having babies and they've got some complex cardiac problem or something.
Yes.
They like cannot labor. They've got to have a C-section, or like you're part of the decision-making tree in that, and then managing complications that can be catastrophic in like a 5-minute period. So
Right. Things happen
you
very
guys are
quickly.
truly heroes.
Oh, thank you. Yeah, and when it comes to anesthesia consults, we're important when it comes to who else do we need involved in the care of this patient. So do we need a hematologist involved? Do we need a cardiologist involved? A lot of times, we're dealing with young, healthy patients, but things are very different in pregnancy. And so understanding the physiology of pregnancy and how that might shift, for example, a cardiac issue that doesn't cause a problem, and now in pregnancy it does, and how will the anesthesia that we choose affect this patient? So thinking through all of that ahead of time and having all of the information that we need, what labs do we need, et cetera, that really is a big part of what we do.
Yeah, and I love that you are still able to do this as a per diem part-time anesthesiologist. Were you worried when you went through the process of negotiating with your group that you were not going to be able to do the OB shifts? Because there's definitely some gatekeeping in anesthesia groups, just like any kind of practice where there's certain shifts or certain specialties or procedures that are kind of protected, or they have some sort of a label to them that makes them more money or something like that. So tell me a little bit about how you negotiated this and what they said, and how you got it so that you could do what you really love doing on a part-time basis.
Yeah, I think I'm very lucky, especially with the OB anesthesia. I know a lot of other people who do locums or per diem, they have to really seek out those OB shifts, and sometimes they're only 24 hours or whatever the case may be. I think I was lucky because I already had a relationship with the hospital and I was already very involved with labor and delivery. I'm the only fellowship trained OB anesthesiologist. There is someone who is kind of the head of OB anesthesia department, but other than her, I'm kind of the second person that they recognize as an expert in labor and delivery. So I wasn't sure if they would keep putting me on labor and delivery. I hoped. It was a risk. I didn't ask them to guarantee that or anything. I think I just made sure that they knew that this is what I loved. This is what I think I'm good at. And I think the, I hope, I guess, that the OBs that work there and the other labor and delivery staff, also would want to keep me around there. So when I approached it, I explained the situation that I was going through, this grief, whatever you want to call it, this time where I needed to figure out what I needed, and take care of myself. Yeah, I mean, I always say I wanted to be with my kids more, which is, of course, true. But that's almost been like the secondary gain where I've it's all just kind of really come together in a really nice way for me. But it was a huge risk, and I had to go in telling myself that if they said no, I would have to take a break. I would have to step away for a little bit. And I had researched locums and figured out, okay, this is my plan B, C, and D. If this doesn't work out, after I give myself space. And you just kind of have to hope that if you're, I mean, we're doctors, we're needed. But you have to kind of remind yourself that you are valuable. And I just told myself, if this doesn't work out, you'll find something else. But it was scary. I'm still a little scared.
What you just described is truly the definition of confidence. You hope that things work out in your favor, but you're okay if they don't work out in your favor. You know that you can pivot. You know that you have great skills. You're an expert in this particular field. And if they say no, you're going to take a break and you're going to reassess. And also the fact that you just said, like, it's still scary, it's
So
still uncertain. We're always navigating uncertainty.
yeah, it's hard. You almost have to really just tell yourself over and over, like, I'm that you're worth it. And as far as financial impact and stuff, I was lucky that I knew I was going to be okay financially. My family was going to be okay financially, and that's a huge privilege that I have. But it's funny that that isn't almost even enough sometimes. You still are scared, and also we worked so hard for this. I don't you know, we don't want to. I love what I do, but I also work so hard to get here, and so taking those risks, it is scary, but for me it's been very, very worth it.
I'm so glad, and I'm so excited to see what you have coming down the pipe. And I know you're keeping it close to the vest, but really excited to find that out. I want to give you a chance to tell people where to find you, but first, I want to know if you
Yes.
have any advice for listeners who are feeling like they're stuck on the treadmill of achievement and they want to make a change, but they don't know what to do.
So I want people to know that there are so many options. I mean, I think that my particular scenario is not a scenario that I know of anyone else doing, just working at the same place, but fewer out, but there are so many options, and don't be afraid. Know your worth and know that achievement can come, I think, in different forms. It's not always becoming the department head or the head of this committee or that committee. You can be valuable and achieve great success in a lot of different ways, and honestly, go for it.
I love that you said that because I remember when we were working together that one of the core values that you identified was achievement. And you're like, I kind of feel bad saying that.
Yeah.
We redefined it in a way where it's like mastery, it's being an expert, like you said,
Right.
and then being able to share that with other people. And you're doing that now. So I think it's wonderful.
And I think just one more thing, because there is so much value in educating the public. I think as doctors, we have been shying away from that for so long. And I've always known inside me that I think it's the right thing to do. It always felt right. And I think we're told in certain ways that we shouldn't be doing this. We should just be sticking to our clinical work and not educating outside of our jobs. And I think that's my newest kind of epiphany is that actually no, this is the right thing to do. It's good for everyone and we can't be afraid to do it. And if that's what we want to do. So
Wonderful. Well, tell us where to find you.
okay, so if you would like to listen to my podcast, it's called The C-Section Experience. It's on all the usual platforms. We have an Instagram associated with the podcast. It's at the CSX podcast. And then I am just starting my own professional Instagram page. Please come follow me if you want. It's at Jen Wagner, MD. So,
Okay, well, I'll definitely link to that and everybody go there and start following Jen. I already did that and I'm
yay.
so excited to see what you put out in the world. So
Yeah.
thank you so much
Thank
for
you,
sharing,
God.
being on the podcast.
Yeah.